Good evening. Today my topic is cataract. We'll see what is cataract, what are the types of cataract, pathophysiology, the causes, the physiology, clinical manifestations and the management, mainly surgical management, nursing management and the health education should be given to the patients. So what is cataract? Cataract is a clouding of the lens of the eye, which is typically clear. For people who have cataracts, seeing through cloudy lens is often like looking through a frosty or fogged up window. So clouded vision caused by cataracts can make it hard to read, drive a car at night or see the expression on a friend's face. So cataract is a clouding of the lens in your eye. So cataract is the clouding in the crystalline lens of the eye, varying in degree from slight to complete opacity and obstructing the passage of the light. So cataract is a clouding of the lens of the eye or opacity of the lens that leads to blurring of vision and eventually loss of sight. So when the clouding occurs, it keeps light rays from passing through the lens and focusing on the retina. The retina is a thin layer of nerve tissue that lines the inside of the back of the eye and is sensitive to light. So the cataract happens when the protein in the lens of your eye starts to break down and clump together. This causes the lens to become cloudy and it will affect the your eyesight. So you can see the normal human eye lens is clear, flexible, biconvex structure located directly behind the pupil. It measures about 10 millimeter across and 4 millimeter thick. And its main job is to focus light onto the retina. So function and properties, light focusing. So the lens bend light passing through the pupil to create sharp images on the back of the eye. So accommodation, that is another function, changes the shape, flattening for distance and curving for close of views using surrounding muscles. So these are the functions of the lens. So cataract definition is a medical condition where the normally clear lens of the eye becomes cloudy, which cloudy blocks or scatters light, making vision blurry, hazy or dim. So the clear lens at the front of the eye is made from special proteins. Cataract forms when these proteins break down and create cloudy patches on the lens. Over time, the patches can grow bigger, causing blurry vision. Main types of cataracts. There are different classification. Main types are age-related cataracts, congenital cataracts and trauma-related cataracts. So here you can see the common type by location. That is, first one is nuclear cataract. In this form, the center, the nucleus of the lens and are linked to aging. So the center turns yellow or brown and make distant vision blurry. Second one is cortical, according to the location. Cortical cataract, these look like white wedge-shaped spikes that start at the outer edge of the lens and move towards the center. They scatter the light and cause glare. Then the third one is posterior subscapular cataract. So nuclear cataract. Nuclear cataract is the most common type of eye cataract. It causes the central zone of the eye's natural lens to slowly yellow, harden and turn cloudy over time. This gradual process impairs distance vision, creates severe glare at night and dulls the color perception. Nuclear sclerotic cataract is a type of cataract whereby the cloudiness appears at the central part of the eye's natural lens. It is also one of the most common type of cataract. The cause of nuclear sclerotic cataract is largely due to aging. So here you can see the nuclear cataract and the nuclear sclerotic cataract. This is the common type by location. So nuclear sclerosis is a normal age-related hardening and yellowing of the eye's lens, whereas a nuclear cataract is advanced through clouding of the lens that actively blocks the vision. Both affects the central part of the lens, nucleus. but they differ significantly in severity and impact. So the difference is in nuclear sclerosis, a natural aging change where new lens fibers crowd the center, making the lens slightly hazy or bluish gray without causing major vision loss. But in nuclear cataract, a pathological progression where proteins break down and clump, turning the center densely yellow or brown and creating true opacities that blocks the light. Then cortical cataract starts at the edge of the lens and move towards the center. They are characterized by white wedge-like opacities that create the problems with the glare and depth perception. People with cortical cataracts often have trouble driving at night due to increased glare from the headlights. Then posterior subscapular cataract. It's a cloudy area that forms at the back of the eye's natural lens, right in the direct path of the light. This often causes strong glare halos around the light that blurry near the vision, and it tends to progress faster than other types. So you can see the diagrams of different types of cataract. Cortical, this one, congenital, nuclear, secondary, traumatic, and posterior subscapular. These are the different types of cataracts. So congenital cataracts, this is the types of cataract by cause. Congenital, traumatic cataracts due to physical injury, chemical injury or radiation exposure to the eye. Secondary cataracts are due to certain medical conditions like diabetes or use of certain drugs like long-term steroids. An acquired cataract is a clouding of the eye's natural lens that develops after birth, mostly due to aging, physical injury or medical conditions like diabetes. So acquired cataract, as I told, it does not have just one single alternative because acquired means broad medical categories are there. So most common and direct alternative for the primary type of acquired cataract is age-related, is a senile cataract or age-related cataract. So acquired cataracts are also referred by several other specific names. Specific subtypes are senile or age-related cataract, metabolic cataract due to metabolic diseases like diabetes or other biochemical changes. Complicated or secondary cataract develops as a result of existing eye diseases such as chronic uveitis or glaucoma. Toxic or drug-induced cataract brought on by the prolonged use of specific medications like corticosteroids. So here you can see the type of cataract, the cause, the age group and symptoms. In age-related is naturally aging process, that is the cause, 75 and older, gradual clouding and blurred vision. Traumatic cataract, serious eye injury or trauma is the cause. At any age it can develop, and immediate or delayed vision problems, these are the symptoms. A radiation cataract, ultraviolet exposure from the therapy of or excessive sun is the cause at any age group. So the symptoms are cloudy lens vision problems. Pediatric cataracts or congenital, there is a developmental factors that is the cause. Infants and children are affected. Visual impairment if untreated, that is the symptom. Then secondary cataract due to scar tissue after cataract surgery at any age, vision problems after successful cataract removal. Congenital cataracts, it is they are those present at birth or developing during childhood. Genetic factors, infections during pregnancy or metabolic disorders can cause them. So early detection and treatment are essential to prevent vision problems and ensure proper visual development. Secondary cataracts occurs when the lens capsule left intact during cataract surgery becomes cloudy over time. This condition can impair the vision similarly to primary cataracts. Symptoms include blurred vision and glare. Treatments are painless laser procedures to restore the clear vision. Traumatic cataracts are due to injuries leading to lens clouding and vision impairments. Causes include blunt trauma, sharp objects, radiation, chemical burns, and electrical shocks. Symptoms are blurred vision, glare, and double vision. Treatments is surgery and protective eyewear crucial for prevention. Posterior subscapular cataracts, they can progress rapidly, forming towards the rear of the lens. This condition affects reading vision and causes glare or halos around the lens. It is more common in people who use steroids, who have diabetes or who are having myopia or nearsightedness. Because they progress rapidly, early cataract surgery is crucial to prevent severe vision impairment. Risk factors: aged people over 50 are most at risk. Genetics, having family members with the same condition, lifestyle factors like smoking, drinking alcohol, and spending time in the sun without wearing sunglasses. Health conditions, diabetes, and other health issues. Medications, especially mainly steroids and statins, can increase the likelihood of death. Risk factors: medical conditions, environmental factors, genetic factors, and habitual factors. So cataract develops when the normal clear lens of the eyes becomes cloudy. The risk factors are into mainly categories that like that environmental factors, medical, genetic, and habitual. So risk factors mainly we told already, aging is the most important factor. Then medical conditions such as diabetes, lifestyle factors like smoking introduce harmful oxidants in the body, and while excessive sunlight exposure without UV protection can damage the lens over time. And genetic predisposition causes, mainly the many risk factors can lead to the cause: smoking, alcohol, diabetes, nutritional deficiency, unprotected exposure to UV sunlight, steroid use, some diuretic medicines, and some tranquilizer medicines. So this is the picture or diagram which shows the causes: aging, diabetes, excessive intake of alcohol, excessive sunlight exposure, hereditary causes, hypertension, and overweight. So here you can see the cataract eye with the foggy lens. So this is a normal healthy eye, but this eye with the cataract cloudy lens. You can see that. Here also you can see cataract. You can see clouding of the lens in the eye that affects the vision. So here you can see the normal lens. Here the lens is clouded by cataract. So pathophysiology: the clear lens of the eye transmits light rays entering the eye and focus them on retina. With aging, lens proteins progressively denature, causing increasing in density and yellowish brown coloration of the lens. Other factors such as blunt force trauma can cause thickening and irreversible whitening of the lens. A certain cloudy lens lacks the ability to transmit and focus the light rays on the retina. So this manifests as blurry vision or loss of vision in advanced cases. Common signs of cataracts: you can see frequent changes in eye prescription, changes to the color of the pupil. It may look white, blurred or dim or misty vision, difficulty in seeing, low light or at night, sensitivity to light looks too bright or glary, colors look faded, muted or more yellow, seeing a halo around the bright light, everything looks more washed out. So painless blurry vision, that is the characteristics of cataract. The patient perceives that surroundings are dimmer, as if the glasses need cleaning. Then light scattering is common. Then often other effects include myopic shift, astigmatism, diplopia or double vision, color shift. Then color value shifts to yellow brown. Then reduced light transmission, presence of white pupil, reduced visual acuity, progressing to blindness. So the clinical manifestations by this diagram, it is self-explanatory: cloudy or foggy vision, lights with halos, double vision, poor night vision, light sensitivity. So these are the 7 warning symptoms of cataract: blurry vision, difficult night vision, double vision, halos, color changes, increased sensitivity to light, and recurrent changes of glasses. Common symptoms: cloudy or blurry vision. Why? The reason is light feels foggy or murky, like looking through a dirty glass window or a steamy car windshield. Poor night vision, low light vision drops significantly, making tasks that like driving after dark difficult due to reduced contrast and clarity. Light sensitivity and glare, strong sunlight lamps or oncoming vehicle headlights appear dazzlingly bright and uncomfortable to look at. Halos around lights, glowing rings or starburst or fuzzy circles appear around the bulbs, street lights or headlight at night. Faded or yellowed colored. Hues lose their bright natural vibrance and whites can take on a muddy brownish or yellow tint. Frequent prescription changes, eyeglasses or contact lens numbers keep shifting because the clouding lens alters the light focus over time. Double vision in our eye, a single object might appear as double image or ghosted shadow even when the eyes are closed. Diagnostic tests are mainly visual acuity tests, slit lamp examination, ophthalmoscopy, retinal examination with pupil dilatation, intraocular pressure can be checked by tonometry to measure the intraocular pressure. So, diagnostic test, visual acuity test, eye examination through ophthalmoscopy, slit lamp examination, biomicroscopic examination, slit lamp, biomicroscopic examination for testing iris and retina. So age 40, lens proteins start to break down. So we have to do regular eye examination, crucial for early detection. Comprehensive dilated eye examination, best way to diagnose the cataract. Visual acuity test to assess the impact on the vision. Prevention of cataract. How will you prevent cataract? Wearing sunglasses or other UV protective eyewear. Then a diverse nutrient-rich diet is fundamental to our health, including eye health, especially vitamins A, C, and E. Food containing all this we have to eat. Then lutein and zeaxanthin are found abundantly in green leafy vegetables. Then reducing or stopping smoking, moderation of alcohol consumption, routine eye examination. That is how we can prevent the cataract. Management of cataract, mainly surgery. So cataract surgery, you can see. The most common type of cataract surgery is phacoemulsification. During this procedure, a probe is inserted into the eye and uses ultrasound energy to rapidly move the tip of the probe back and forth to break up the cataract. The doctor then suctions out the lens as seen on the top image. The outer housing of the lens, called the lens capsule, is left in place after removing the lens. The doctor places the artificial lens into the capsule or the natural lens used the way as in the bottom image. You can see the picture. So cataract surgery is safe, quick outpatient procedure where an ophthalmologist removes your eye's cloudy natural lens and replaces with a clear artificial intraocular lens. Here you can see the intraocular lens is kept. Cataract surgery mainly refers to the procedure to treat the eye conditions cataract in which the affected lens is removed and replaced with artificial lens, intraocular lens. How is cataract surgery conducted? Incision is made and the lens, cloudy lens is removed and intraocular lens is implanted. So small incision is made in phacoemulsification. This is the most common type of cataract surgery. The surgeon makes a small cut or incision on the edge of the cornea. Cornea is the clear dome-shaped surface that converts the front of the eye, that covers the front of the eye. A tiny probe uses ultrasound waves to break up the cloudy center of the lens. The lens is then removed by suction through the same incision. Extracapsular surgery. During this surgery, a large incision is made on the edge of the cornea to remove the hard center of the lens in one piece. The rest of the lens is then taken out by suction. So phacoemulsification, types of cataract surgery, phacoemulsification, femtosecond laser assisted cataract surgery, extracapsular cataract extraction and intracapsular extraction. We will see one by one. Phacoemulsification, this advanced and widely used technique uses ultrasound energy to emulsify, break up the cloudy lens which is suctioned out of the eye. The removed lens is replaced with an implanted artificial intraocular lens. Phacoemulsification is known for its minimal incision, rapid recovery and excellent visual outcomes, often reasonably priced. Okay, extracapsular cataract extraction. In this procedure, the cloudy lens is removed in one piece while the back portion of the lens capsule is left intact to support the new intraocular lens. Intracapsular cataract extraction. This older technique involves removing the entire lens and its surrounding capsule, and ICCE is rarely performed today and is reserved for unique cases where the lens capsule cannot be preserved. Then laser assisted cataract surgery. The cutting edge method uses laser technology to perform the key steps of cataract. So the laser assists in making incisions, softening the cataract and fragmentation of the lens for easier removal of the lens. Advanced cataract surgery techniques. Already we have discussed about phacoemulsification. That is, ultrasound waves are used to break down the cloudy lens before implanting the intraocular lens. Advantages: mainly invasive, quick recovery time, requires only a small incision. Then femtosecond laser assisted cataract surgery. In this, laser technology is used, enables the creation of exact incision and the fragmentation of cataract before the removal. The technique delivers better precision and cut down the need for ultrasound power during operations. Advantages: greater precision and safety, faster healing process and lower risk of complications. So in laser assisted cataract surgery, cutting edge technology, advanced features are bladeless corneal incisions, precise capsulotomy, automated lens fragmentation, custom treatment planning, enhanced surgical precision. Benefits: provides greater surgical accuracy, ensuring optimal precision and safety during the procedure, uses reduced ultrasound energy, minimize tissue damage and enhancing overall patient comfort, achieves more precise lens positioning for improved long-term visual stability and clarity, delivers better visual outcomes, restoring the sharper vision and reducing the dependency on corrective lens, promotes faster recovery. Extracapsular cataract extraction stands as a classical cataract surgical procedure which requires a big incision to extract the clouded lens in the entire before implanting a new lens. A new lens is then implanted. Medical professionals normally advise the surgical approach for patients who have dense cataracts. Advantages: suitable for severe cataract, effective in complex cases. Intracapsular cataract extraction is a surgical approach which removes the lens together with its encapsulating capsule. This technique remains very uncommon. Doctors advise this procedure for treating severe eye traumas. Advantage: this procedure serves particular situations when alternative treatment methods fail to provide solutions. Useful for special cases where other methods are unsuitable. So intraocular, you can see the clouded lens are removed and intraocular lens are implanted in place. Micro-incision cataract surgery. Surgical incision is reduced to under 2 mm, minimizing the visible scars, results in minimal tissue trauma, promotes faster wound healing, reduces astigmatism and improves precision for better visual outcomes, enhances visual recovery for quicker return to daily activities and improved eyesight. So then manual small incision cataract surgery, that is MSICS, that is cost effective and quality. Advantages: is cost effective procedure, shorter surgery time, reducing the patient's stress, ensure excellent visual outcome, require lower technology dependence, proven safety records. Small incision technique minimizes the tissue disruption, ensuring faster recovery and improved surgical outcomes. No stitches are required. Quick visual recovery allows patients to resume the daily activities within a short time. Highly suitable for dense cataracts. Economic advantage makes the procedure accessible while delivering high quality results for every patient. Bladeless cataract surgery, revolutionizing vision care. Bladeless surgical procedures represents the pinnacle of ophthalmological innovations, offering an unprecedented approach to vision restoration through advanced laser technologies. Okay, eye hospitals in Lucknow have emerged as pioneers in implementing this transformative surgical procedure. Bladeless surgical procedures, patient approach, advanced digital eye mapping to accurately assess the eye anatomy and optimize surgical planning, comprehensive medical consultation to evaluate patient health and address any pre-existing conditions, precision surgical planning ensuring meticulous alignment of the procedures to the patient's needs, and personalized treatment category strategies designed to maximize the surgical effectiveness and outcomes. Then, laser surgical interventions, computer guided laser precision enabling accurate and consistent execution of surgical steps, bloodless surgical approach reducing the trauma and minimizing the risk of post-operative complications. Minimally invasive techniques promotes faster recovery and reduce the surgical downtime. Real-time surgical corrections for immediate adjustments during the procedure. Advanced lens fragmentation facilitating efficient cataract removal. So, bladeless cataract surgery, the future of eye care. So, utilization of cutting-edge laser technologies ensuring greater accuracy and precision during the surgery. Implementation of precision surgical interventions tailored to the unique needs of each patient. Adoption of computer-guided treatment protocols to enhance surgical outcomes and consistency. Integration of advanced diagnostic capabilities for thorough pre-operative evaluation and planning. Application of minimally invasive approaches reduces the recovery time and surgical complications. So, technological landscape of modern cataract treatment. Femtosecond laser precision enabling high accuracy incisions and cataract fragmentation. Computer controlled surgical techniques ensures consistent and reproducible surgical results. Real-time imaging integration offered enhanced visualization throughout the surgical procedure. Customized treatment mapping designed to address individual patient requirements effectively. Blade-free surgical interventions minimize the tissue trauma and improving the overall surgeries. Risk of cataract surgeries: eye infection, bleeding in the eye, ongoing swelling in front of the eye, swelling of the retina and detached retina or retinal detachment, damage to other parts of the eye, pain that does not get better with over-counter medicine, blurred vision, seeing halos, glare or dark shadows, vision loss, IOL implant may become dislocated, moving out of position. Complications, mainly eye infection, blurred vision and retinal detachment. These are the three main complications. Nursing diagnosis for this cataract: risk for injury or falls related to decrease of blurred vision before and right after surgery, deficient knowledge related to post-operative care, risk for infection related to surgical eye incision. Pre-op interventions adjust the vision, reduce the fear, make the area safe, clear away the loose drugs, keep night lights on and put the call bells or within the patient's reach, or call bells or glasses within the easy reach of the patient. Common other nursing diagnoses are disturbed sensory perception, visual perception. Patient is unable to see clearly, making navigation and ADS difficult. Risk for injury, vision deficits increase likelihood of falls. Self-care deficit, trouble with hygiene and all. Anxiety, deficient knowledge, unaware of procedures or potential for recovery. Goals: patient maintains safety, avoids falls or injury. Patient can describe their condition and care requirements. Patient demonstrates improved or stabilized self-care abilities. Anxiety and fear are reduced with education and support. Post-operative nursing care. Eye protection. Encourage the use of eye shields or sunglasses, especially outdoors or during sleep for the first few days. Activity modification is the advise avoidance of bending, heavy lifting, or activities that sharply raise the intraocular pressure. Instruct the patient on safe movement and posture. Medication and wound care. Strictly adhere to the prescribed antibiotic or anti-inflammatory eye drops to prevent the infection. Teach the sterile drop installation technique, sterile procedure. Then detecting the complications. Report increased pain, swelling or loss of vision or discharge. Hygiene and infection control. Wash hands before touching the eye. Educate on avoiding tap water exposure, especially during showers or washing. The face functional recovery. Gradually reintroduce daily activities starting with light tasks. Then avoid strenuous activities until cleared by the ophthalmologist. Then promote follow. Reinforce the importance of keeping all scheduled post-op appointments. Nurses often should help for the transportations and for the reminders or follow-up. Health education, remind the patient to attend the checkup following day after surgery. A follow-up appointment is needed to monitor healing process. Instruct the patient to avoid activities such as heavy lifting, bending over at the waist, or engaging in strenuous physical activities that may increase the risk of eye injury or infection. Instruct the patient to wear a plastic or metal shield covering the eye with perforations. To protect the eye from accidental injury, instruct the patient to use protective eyewears and limit outdoor activities. Instruct the patient to be cautious about driving or operating any heavy machineries. Teach the patient how to administer antibiotic ointments or drops, including the steroids. Instruct the patient to watch out for the development of complications such as sharp pain on the eye or clouding out in the anterior chamber. Analgesics should be administered. Post-operative interventions, protection of eye, give eye drops, teach the patient or caregiver to wash hands first and apply antibiotics or anti-inflammatory drops without touching the tip of the eye. Control the activities like heavy lifting, bending at the waist, sudden movements or straining. Watch for any danger signs like sharp pain over the eye, swelling or thick purulent discharge or sudden vision loss, and report them to the doctor right away. Nursing care plan. First one is for infection related to invasive surgical procedures. Second one, disturbed sensory perception related to poor visual acuity, sensitivity to high light, cataract, and changes in the eyes due to aging. So, disturbed sensory perception related to poor visual acuity, sensitivity to light, cataract, and changes in the eyes due to aging. Next, so we have seen what is cataract, what are the signs, clinical manifestations, what are the types, the causes, the pathophysiology, the treatment, the nursing care plan. So cataract is an eye disease caused by the clouding of the eye's natural lens. Cataract is a clouding of the lens of the eye. As a cataract develops, your eyesight may become blurry. You may have halos around the lights, double vision and poor night vision. Colors may seem faded. In its early stages, vision loss caused by cataract may be helpful by using different eyeglasses, a magnifying glass or stronger lighting. Over time, cataract surgery may be needed to improve your eyesight. Cataract surgery is one of the safest and most effective surgeries. So, cataract is the eye disease caused by clouding of the eye's natural lens. Most cataract are common in older age. So, different types we have seen, like nuclear cataract. Then we have seen congenital cataract, acquired cataract due to different reasons or degeneration of the already formed normal lens fibers. And we have seen the etiology, the environmental factors, genetic factors, drugs and toxins, intraocular disorders, the risk factors like aging and other associated conditions, toxic factors, nutritional factors, physical factors, systemic diseases. And we have seen the pathophysiology, the clinical manifestations, the diagnostic evaluations, and the management, mainly the surgeries, intracapsular cataract extraction, extracapsular cataract extraction, phacoemulsification, and the lens replacement, mainly by the recent surgeries are laser surgeries. We have seen the complications like retrobulbar hemorrhage, rupture of post-capsule, acute bacterial endophthalmitis, malposition of intraocular lens leads to astigmatism, corneal edema, nursing diagnosis, degree sensory perception, visual related to opacity of lens, pain or discomfort related to surgery procedure, risk for injury related to diminished vision, anxiety related to cataract and its management. So we have seen the preoperative care, especially for eye drops for dilating eyes, are administered every 10 minutes for 4 doses, at least 1 hour before the surgery. Antibiotics and corticosteroid drops may be administered prophylactically. And then we have seen the patient education, postoperative management, and health education. Mainly, patients should wear a protective eyeglass after the surgery. Sunglasses should be worn during the daytime. A clean, damp washcloth may be used to remove the slight morning eye discharge. If there is any pain or redness in the eye, it should be informed, and avoid rubbing or pressuring on the eye to avoid pressure on the sutures. Avoid bending at the waist, and avoid limitation of reading, restricting bending and lifting of heavy objects. Avoid straining on bowel movements, and report signs of swelling or discharge or pain to physician. Patient receives verbal and written instructions regarding how to protect eye. Medication administration. So cataract is the clouding of the lens of the eye, and it has to be treated mainly by surgery. Thank you so much.